Yes, 1, 2. 1, 2. Yep. All right, 1, 2.
so long as this around the country, it's going to continue this. It's unbelievable. called the Western Alliance. Which
Good morning. Thanks, Tony. I invite you to all take your seats and we'll kick off proceedings. I'd like to welcome Warren Daly, a Ngunnawal elder, to come and welcome us to country.
Thank you very much for that. You'll notice that it's not Matilda standing up here. I'm one of the Ngunnawal elders. My name's Warren Daly. Firstly, I'd like to thank Leanne Coleman for asking me to give this welcome to country for the National Rural Health Alliance breakfast at the Parliament House, which is on Ngunnawal country. Distinguished guests, ladies and gentlemen, firstly I acknowledge other elders, past, present and emerging, and I thank them for their continuing contributions they've made to life in this city and region. I also welcome other Aboriginal and Torres Strait Islanders and all nationalities attending today's event. For some of you, this may be your first welcome to country, and the Ngunnawal people have been custodians of this land for over 60,000 years, and our ancestors have passed down this welcome to country to us. In our tradition, before entering another person's country, you'd always announce your arrival, and not enter until invited to do so by an elder or traditional owner. As in the white man's world, you would not want your neighbour or total stranger entering your home or yard without first asking permission to do so. The reason for this practice is it protects your spirit while you're in another person's country, but also shows respect to the people and the country you are entering. For those of you that have travelled to be here today, I wish you a safe and enjoyable journey back to your loved ones. So Yangu, Ganawiri, Anamanyan, Gunwalwari, Anawalwari, Dara, Nana, Gunna, Garambangan, Murrumbidgee, Mulungari, Mulundinjin, Galamban Anyi, Narragansett, Wal Uyiri, Yarrambin Binyin. Today we're all gathering together on Ngunnawal country. This country is my ancestral home. We're keeping the pathways of our ancestors alive by all walking together as one. Ngana Yarrabai Yangu, you may all leave your footprints on the land of the Ngunnawal people. Yamalandi, welcome.
Thank you very much, Warren. I'm really excited today. Normally we have 2 Warrens in the room, and today I've counted 4. So there is a little bit of a rabbit play going on in Parliament House today, but it's lovely that at least these Warrens have been here for, at least one of the Warrens has been here for a very long time through his ancestors. So I really appreciate that very warm welcome to country. I do want to acknowledge the Ngunnawal people as the traditional custodians and as a country girl who grew up on Wilma country in Wagen in the southwest of Western Australia, and now live, and for the last 20 years have lived with my husband and children and grown a family on the Mary Nation lands of the Murray River in the Riverland in South Australia. As I mature, I think, become increasingly respectful of that connection to land and how important that is. And we're here today to talk about the impact of climate change on health, and having been as a girl from the bush and living in now an area that's really impacted by drought and water scarcity and food security, and growing up in a country and a family farm that, I really remember parts of my childhood where we had drought and my father having to kill stock who were starving because we couldn't afford to pay for food to feed them. It is not a new issue for us who live on the land. So it means a lot to be here on Ngunnawal country today, and I bring with me that perspective of coming from rural lands, rural country and rural communities where this stuff really matters to us. So it's a great privilege and pleasure to be here with you all and with our friends, Parliamentary Friends of Rural Health again, and that's a friendship that we deeply appreciate, and again, thank you for continuing to welcome us back. Obviously we're not upsetting you too much each time we come. So I want to welcome you all to the first Parliamentary Friends event for the 46th Parliament, and welcome every parliamentarian in the room, the National Rural Health Alliance staff, council members, board members, and everyone else here today from the health sector and more broadly. It's so great to have such a large number of people in the room today. So the National Rural Health Alliance, for those of you who don't know us, we now have 44 members and growing, and at a time when there is increasing focus on rural health and wellbeing, and increasing interest in our communities and our networks coming together to do what we can to improve the sector. I want to acknowledge and thank the two Warrens that have Warren Ench and Warren Snowden for their ongoing leadership and dedication and passion for rural health, and for the leadership of this Parliamentary Friends group and their consistent advocacy for rural health. So today's breakfast will run as follows. The two Warrens will say a few words, although I've never known them to say a few, but we would love to hear from them both as co-chairs of the Parliamentary Friends group. Next you'll hear from Professor Tony Capon, who's the Director of Monash University's Sustainable Development Institute and former Professor of Planetary Health at the University of Sydney. He'll present the big picture view of planetary health, the links between environmental factors and health, and how these often hit rural Australians particularly hard. And then Dr. Anna Greta Hunter, a physician, a cardiologist, a lecturer at Australian National University Medical School, will talk about some of the specific health impacts of climate change, including the impact on heart health. And then Professor Jenny May, Rural GP, former Chair of the Alliance and Director of the University of Newcastle Department of Rural Health, will talk about some of the mental health impacts of climate change and natural disasters, as well as the impacts on our rural communities. And finally, Gabrielle O'Kane, our CEO, will wrap it all up and explain the Alliance's future direction in relation to climate and health. So now that you know what you're in for, does anyone want to leave, or you're all still happy to be here? So after all of this, we encourage everyone to stay on and network. We have some of our council members and board members and others from the health sector here today, so there's a lot of knowledge and experience in this room today. So I've introduced myself as Tanya Lehman, Chair of the Alliance, and a bit of why this matters to me as a country girl, and I am really excited to be part of the conversation that we're going to have this morning. I'd also like to say a few words about why we're here and why this matters to the Alliance. The bushfires that have swept across much of Australia have been devastating, and I'm sure that many people in this room would have been affected by them in some way. whether you're from a rural community and have lost property, or know people who have or have to deal with the poor air quality here in Canberra, or have just been personally affected by seeing the stories of those on the news. In fact, you might have seen that a recent Australian Institute survey found that over half of all Australians have been directly affected by the bushfires in some way. They may have been forced to change travel plans, or not have been able to work, or simply change their routine, such as not going on for a run outside in the morning because of the air quality. Here at the Alliance, our vision is for healthy and sustainable rural and regional and remote communities. And so we're very focused on things like improving access to high quality healthcare in these communities, supporting measures to boost the workforce and make sure that health professionals want to study and work in the bush, and promoting service delivery models that make sense for rural Australia. But we wouldn't truly be supporting healthy and sustainable rural communities unless we acknowledge the link between climate change and health for the people in rural Australia. And it's not just us here at the Alliance. Almost all of the biggest health organisations in Australia have made a strong statement on climate change. Indeed, a lot of our members, like the Royal Australian College of General Practitioners, the Australasian College of Emergency Medicine, and the Australasian College of Rural and Remote Medicine, have been at the forefront of advocating for climate action. On your tables is a copy of the Alliance's position statement on climate change and rural health. In this position statement, we make it very clear why climate change is an issue, specifically for people in rural Australia, and how dealing with climate change is essential to improving our health and well-being. I'd like to briefly go through how the Alliance plans to progress this critical issue before handing over to the other speakers to provide more in-depth perspective about climate and health. Our position statement starts by acknowledging climate change as a threat to human health. This sounds obvious to many of us, but unfortunately there are still some who would seek to deny that the climate is changing, or that human activity is making it worse, or that climate change is a bad thing. Making it clear that we acknowledge there is a problem is a vital first step. Our position statement then sets out what specific impacts climate change has on rural Australia, and I know some of the other speakers will provide more detail on this. The obvious link is that rural Australia is more susceptible to extreme weather events like drought, bushfires, floods and cyclones. Many of you are from rural areas and represent rural electorates, and I don't need to remind you of these catastrophic events. Extreme weather events cause injury themselves, but also long-term physical and mental illness. Then we need to remember that rural communities already experience substantial social and health inequalities. Climate change is a risk multiplier and can make already unfair situations worse. The World Health Organisation says that areas with weak health infrastructure will be the least able to cope with climate change. And then there's the less obvious but still severe impacts of climate change on rural communities. We point to them in our position statement, but just to highlight a few. There's an increase and change in the patterns of vector-borne, waterborne and zoonotic disease, air pollution from bushfires, dust and aeroallergens, food insecurity from changes in land use, crop yield, biodiversity loss and drought, and migration and forced displacement and social unrest and conflict. Let's not forget too the impact that climate change has on water security, which we'd all be aware is a huge issue for rural Australian communities, and certainly as someone living in the Riverland on the banks of the Murray River, I feel it really acutely in lots of conversations in the people I love and work with every day. I'd encourage you all to read the Climate Council's 2018 report, Australia's Water Security in a Changing Climate, if you haven't already. The Climate Council points out that Australia's water security has already been significantly influenced by climate change and that things are getting worse. And they're also very clear about the health impacts of water scarcity and poor water quality, contaminated water supplies, increasing mosquito-borne diseases such as dengue and Ross River virus, and increasing psychological stress in our rural communities. So we've outlined some of the problems. The next question is, what do we do about it? Firstly, we look to all levels of government to take action, urgent action, to reduce carbon emissions. But we also need specific policies that assist rural communities to deal with climate change and transition to more sustainable practices. The Australian Government, along with state, territory and local governments, all have a role to play. in renewable energy. No, I'm talking about measures such as helping with the development of renewable energies in rural communities, establishing emergency responses for the management of things like heat and water scarcity, and other measures to help promote social capital and community capacity. And of course we need a climate and health strategy to provide a strategic framework for governments to respond to this issue. In addition, we need to ensure that rural communities are at the front and centre of climate policy and natural disaster policy. It's important that rural communities are involved every step of the way, and that we harness the imagination, innovation, resilience and can-do capabilities of our people in these communities. I know that having grown up and worked in rural Australia, and I know that many of you will know that too. And what the recent bushfires have shown us is that rural communities are resilient. We band together when we need to. Little bit side note, one of the funniest things at my wedding was the day before, as a country girl who should have known better, in a wedding in January, went out in a low wheelbase vehicle across a stubble paddock to find a place for photos. And unfortunately the stubble got caught under the exhaust of the car and I burnt 300 acres of my father's property. Didn't have photos. It would have been kind of nice, white dress against a black background. But the thing that was so beautiful, incredibly stressful, but beautiful at that time was just neighbours and friends appeared out of nowhere with their firefighting units on the back of their utes. And before long, the fire was put out. I still, to this day, 20 years later, have not lived that down. But the resilience comes from that willingness to band together and work together. And I know that together we can take this issue and work out how to respond in a way that's going to sustain our communities. Most of all, we need a policy response to come from the top and support the ground-up development. We need the commitment from government and the resources to ensure that we're better prepared to try and mitigate climate change by reducing emissions and making sure that our rural communities are better able to respond to it. Thank you, and I'd now like to invite the two Warrens to say a few words. Thank you.
You want me up there first, do you? That's all right.
You're uglier.
I'm used to that.
Younger.
That response is because I often say how unattractive he is. So I think, anybody with a psych degree would understand eventually it rubs off. Well, first of all, I'd like to acknowledge the traditional owners, Ngunnawal people, and pay my respect to elders past, present and emerging. I'd also like particularly to pay my respect to another Warren, with four of us in close proximity. As I said, there's not a lot of wabbits now, there's an absolute plague. So, but we live with that all the time, don't we, mate? Tanya, and to everybody here, it is great to be here to see such a gathering. It's also it's great to Warren and I have been doing this for a while now, and while we may be on different sides of the political divide, we absolutely won in actually many, not just this one, but on quite a number of other issues, Northern Australia and other issues, that we basically speak with one voice on it. And I think it's a very strong way and a good way of making sure that we put a blowtorch on the issues and we don't walk away from it. It's interesting because over the time that we've been involved, there's been many. We come to these dinners and we have a look and what's on the agenda for this time, and there's access to various allied health services, etc. Access to medical professionals, resourcing for a whole range of things. And I open it up this time, and of course there's about 4 pages, and every single sentence says climate change. So, but it's interesting because, I mean, if you've got any way of looking towards getting a focus in this area, you only have to have a look at what's happened in the last 12 or 18 months. And I actually raised this recently, as a government, have challenge of drought, flood, fire, disease, pestilence. We've got Panama disease in bananas up in, I worry about locusts, and of course flood again. I mean, this has all happened in a period of, the drought crept up on us, but everything's happened in a period of 12 months. and all of them are still being worked on together. Nothing's been, they're still all happening. So yeah, there are. So it's little wonder I see where the challenges are coming from this area, and there are other things I think I'm very interested to hear. I think we all in the room know where there are problems, but I'm very, very keen to see from your perspective where the solutions are, and or what you see, because I mean at the end of the day, you've got to have a look at it all. But it'd be great from an organisation like yours. And I mean, one thing there that when you talk about resilience, and adaptation is another one, because we need to change our ways. I think that's absolutely critical. And something I haven't seen in there, which I think, when you talk about mental health, I think somebody's going to be talking about the impact of mental health. Tell you what, nothing impacts more on mental health if you can't afford or can't get access to insurance to protect your assets, knowing full well there's a good chance. And so I think that I would recommend to you that some way of affordable, accessible insurance in these times is absolutely critical for the well-being and the mental health of all people in rural Australia. And we've been faced with that challenge now for over a decade in far north Queensland, and I'm telling you, there's a runaway train coming around the corner at the moment in relation to the recent bushfires. And so if you think it's not going to impact, so I think it's something I would very strongly urge you to consider putting on your list of things that we need to do. So I thank you very much. I'm more about sitting here or standing here listening, and after which the pair of us will sit down and we'll see where we've got a lot of common ground on this and work too, to see if we can champion things together, because it's a lot stronger. So I'll defer now to the other unattractive one, and I'll let him finish it off.
Thanks, Warren the younger. No, we're not. You're younger. Just do as you're told. Warren, thank you very much for your welcome to country, and can I acknowledge the Ngunnawal and Ngambri traditional owners of this wonderful part of the world where I was born. I was born on this country, and just as an aside, as growing up, I knew a few Aboriginal people. We never knew the stories. And to now know that we have an acknowledgement and the re-emergence of the Ngunnawal and Ngambri language is really fantastic for this community. So thank you so much. I've just had a gander at this position paper, which I won't have an opportunity to make any detailed comments on, but I'm actually very encouraged that in fact you've written it, because I think it's extremely important. But before I go any further, I should acknowledge my parliamentary colleagues, and I'll just, if you don't mind, I might just ask them to stand so you can say good day to them. If you wouldn't mind all standing, thank you. Thank you very much for coming along this morning. Now, it's important that there is a good cross-section of the Parliament here. Certainly Coalition members, Labor members, Shadow Minister Chris Bowen. We've got a good collection of people. The Minister for Regional Health had to leave, unfortunately. I'm actually very keen to listen to what you're going to be talking about in terms of climate change and health. It's something which, when I was the Minister, I had cause to make comment on, I recall, and that was some years ago now, sadly. But nevertheless, change happens, but I'm really very pleased to see this document and the issues it raises. And we're reminded by the events of the last little while, as Warren pointed out, of the importance of the full range of health services to addressing the needs of our rural and remote communities. And never would you be in greater demand in the southeast of this country than you are currently. And it raises significant questions around how we're managing workforce, apart from anything else. Do we have sufficient workforce? Yes, some cases, no in others. What do we do to attract workers, and what do we do to actually look after them as well as looking after the people they're looking after? And I think that's a really important thing for all of us. Yesterday was a very salutary day for me. We had the Close the Gap report, and I think the figure I'm mentioning might be slightly off, but it's close to the mark. The figure that actually most dramatically concerned me was the life expectancy gap between people, Aboriginal people who live in rural, very remote parts of this country and the rest of the country. If you're an Aboriginal person living in a very remote community, your life expectancy is nearly 17 years less than for a person, a non-Aboriginal person living in urban Australia, and 8 years less than any other Aboriginal person in the country. Now that should raise alarm bells for all of us, because that's a gap which I think is widening. And it goes to the whole question. I mean, we're talking about people who live in really remote places who don't have the full facility and access to services that those of us who live in even the southeast of Australia are able to access. So I think when we're thinking about the range of issues we've got to deal with, it is really apparent that you've got to be very flexible. We've got to have a nation which understands difference and diversity and the different demands that places upon the health workforce and the health community, both in terms of their professional advice but also the capital infrastructure. And, you know, I need to acknowledge the role of the Royal Flying Doctor in remote parts of this country in that regard. But also, and I think, I know Jenny May, now a professor, well, would you have ever known, whom I've known for many years, you would know from the work you've done that in many parts of the country in regional Australia, the people delivering primary health care to Aboriginal people are Aboriginal community controlled health organisations. And I think we need to make sure that we reinforce their capacity to be able to deal with the intense changes which are happening in the community as well as a result of the environment. I just wanted to make one other observation, if I may, about climate change. A lot's been said about Bruce Pascoe's book, which I think we should all read. If you haven't read it, it's a wonderful piece of literature, apart from anything else, but it is a really, really well written and a book which will open your eyes. But us living in Northern Australia, and Chips is here and he can acknowledge, he'd know this as well as I would, you know, the knowledge of Aboriginal people about their country, we don't really use it. And in the top end of Australia, Aboriginal people have been burning for millennia. And we have only just in recent years realised the importance of those practices in controlling hot fires and how to look after country and regenerate country. And if we're actually serious about mitigating climate change, we'd be looking at those learnings and saying, how can we adapt them to the rest of the country? And I think there's a key lesson here for all of us. So when we're thinking about these issues in climate change, work out how we can learn from those people who lived here for millennia, because it will make a difference. Bruce Pascoe, for example, talks about regenerating native grasses. I had the great privilege when I was working many years ago for the Australian National University to be involved in a program, a research project in the northwest of South Australia, a place called Piblajara. That went for over a couple of years. I was working with Nugget Coombs. And we employed an ethnobotanist to work with the local Pitjantjatjara and Ngarrindjatjara people to go and identify plants and their uses. It was amazing. Absolutely bloody amazing. And yet that depth of knowledge we're not drilling into, and I just encourage you to think about that. Can I thank you very much for the opportunity to be here this morning, and thank you, most importantly, for the work you do for all of us. Thank you.
I'd now like to invite Professor Tony Capon, to this podium. Thanks, Tony.
Thanks very much, Tanya. It's a terrific honour for me to be here with you today, and as a non-Warren and the only other person with an XY genetic makeup on the program today. Just call me Warren, maybe I should say. But yeah, look, thank you very much, Warren One, for welcoming us to Ngunnawal country. And I just wanted, before I make my specific remarks, I think there's some slides that I'll be using, although it'll be a bit tricky for me to see them in a minute. But I just want to say a little bit about my background. Some of you may know me for my work on urban health, but in fact, I'm a country boy too. I was born on a sheep farm in New Zealand in 1960. And in the very far south of New Zealand, my family migrated to Queensland when I was 8 years old. I was raised on a dairy farm in the Mary Valley in southeast Queensland, close to Gympie. As a medical student, I was greatly fortunate to spend 6 weeks with the Royal Flying Doctor Service in far north Queensland out of Cairns Base, visiting many Indigenous communities, mining communities, stations in that region. And I subsequently worked at the Menzies School of Health Research in Darwin for several years, just outside Warren III's electorate in the Northern Territory. So yeah, I get the difference between urban health, rural health and remote health. And my topic today is to broaden out the conversation beyond climate and to connect health and the environment more generally. Frankly, people who live in rural and remote areas are much more in touch with the environment than people that live in cities. And so people are living the changes that we're seeing. So I guess the final remark before I just walk quickly through a few slides is perhaps picking up, I think, on something that Warren too said earlier, that many of the health impacts that we see in rural and regional Australia are actually mediated through people's livelihoods and the changes to those livelihoods, the potential loss of livelihoods in the context of climate and other environmental changes. And that affects health in a variety of ways. Clearly, and most directly, in terms of ability to afford healthcare, which is often more expensive in regional Australia, but importantly also through the mental health consequences of loss of livelihoods, declines in incomes in the context of deep, prolonged droughts, for example. But let me make a few remarks before we get more specific about climate change with the other speakers, about this new concept in the field of health that we call planetary health. And I was greatly honoured to be appointed the world's first professor in this field a few years ago. So let me, I'll try and move a little bit forward so I can actually see what I'm doing with the slides here. So this first slide is a slide that just notes that back in 2015, thank you very much. You don't have to move it too far, just so that I can see which one I'm up to and that I don't skip them as I go through. The Lancet Commission on Planetary Health published its report in 2015. And the title of the report was Safeguarding Health in the Anthropocene Epoch. So on a changing Earth, climate change, one change, a very important set of changes associated with that, but a wide variety of changes happening around the world. And as I say, people in rural and remote Australia well in tune with those changes. So here's a list of the commissioners. I was greatly honoured to be one of those commissioners because at the time I was directing the Global Health Institute for United Nations University. But one really important thing about this slide is the bottom line there that you may not be able to see at the back, but importantly this builds on other work. There's been a long history of work in this space, work framed as One Health, for example, about links between the health of people and animals, and our veterinary colleagues are very engaged in that. Eco-health work that's about ecosystem health and human health and well-being. And importantly, of course, the Brundtland Commission. Now, the report, Our Common Future, published more than 30 years ago. And there a picture of Dr. Gro Brundtland, a medical doctor from Norway, Prime Minister of Norway, went on to chair that commission in the 1980s. And that's really where the idea of sustainable development was brought to the attention of leaders around the world. So yes, development, yes, we do need to continue to develop, but we need to do it sustainably so that the legacy for young people and for future generations is a positive and healthy one. But of course we can take the lens further back. Here's a guy very relevant to health, Hippocrates, more than 2,000 years ago in ancient Greece. Hippocrates was talking to his patients. He was thinking about how they lived and where they lived and what that meant for their health. And he was writing books like this, On Airs, Waters and Places. This was well before we had modern technology in medicine. He was making deductions by listening to people. And of course, as our first speaker from Ngunnawal country said, and was amplified later in the opening remarks, Indigenous ways of knowing about the world are very important. And Waiora was the framing of a major conference in New Zealand last year that was about promoting planetary health and sustainable development for all. It brought together health workers from around the world with an emphasis on Indigenous ways of understanding. Waiora being a Maori word for well-being and healthy waters. I happen to be Ngāi Tahu Maori and Scottish from the very south of New Zealand, but Indigenous Australian ways of understanding their country, Indigenous ways of understanding North America. As Warren Snowden said before, we need to bring this into the conversation, and hopefully we will. We will listen and we will learn from Indigenous ways of knowing about health. So what is planetary health? In essence, we define it as the health of human civilization, the health of our civilization and the state of the natural systems on which it depends. So just a few examples, because I know I've just got a couple more minutes. Emerging diseases. Coronavirus is all over the news at the moment. Now, when we look at recent new virus infections, for example, SARS or H5N1 in this region, Ebola in West Africa, Zika more recently in the Americas, these new infections emerge in the context of environmental and social change. Urbanisation, loss of our forests, climate change, and what that means for transmission of new infectious agents between animals and people. And of course, ways of slaughtering as well in a wet market are also relevant. But it's not all human behaviours. It's not all about vaccines and magic. It's about the way we live. The second slide here, very relevant in rural Australia, providing food for Australians and for the world. But we're seeing multiple environmental changes, and this is affecting food availability and quality around the world. You can see there are a number related to climate change, but also other dot points on this slide. Land degradation and soil erosion, water scarcity for a variety of reasons, a loss of pollinators in many parts of the world, ocean acidification and what that means for fisheries. But importantly, in that Commission report, published, as I said, in 2015, we had a strong emphasis on the positive, on the things that are starting to happen that we need to emphasise more, because we can still meet the challenges. There are multiple ways that we already know about to meet increasing food demand. This is a slide with some projections of food demand around the world, with rising populations and rising incomes, meaning that people around the world can afford different kinds of food. What's ahead? How will we provide that food? And there are a range of sustainable ways of intensifying. We can be more efficient in our use of water and fertiliser. Sustainable aquaculture too. New sources of nutrition and diversification, biofortification, the biological technologies that are relevant in this context. And at the bottom there, reducing food waste, because at the moment, almost 30% of our agricultural land is used to produce food that's never eaten, including in this country. Some food today will be thrown out from these tables. For example, maybe it's all recycled in Parliament House, I don't know, but around the country there is a lot of food waste, and we can do much better. Forests as well, some data here from the Brazilian Amazon, and the importance of forests for the health of all species on Earth, not just for humans, for all other animals, for all other plants, and for the microorganisms we need. So by preserving the forests and retaining them, we can reduce malaria transmission, we can reduce acute respiratory infections, we can reduce diarrhoea. And the circular economy. I know that the current Australian government is showing early interest in the ideas of circular economy, and we need to get really serious about it, because it's potentially enormously transformative and important for the country. Moving from this high consumption, wasteful economy to an economy that focuses on reuse, repair and recycling, and reducing as well, and importantly. So in this context, we shouldn't be talking about waste anymore. It's all resources. The byproduct of one process can be an input into others, and we need to get much, much more serious about this. And of course, China's nudging us seriously to do so, because they're not going to take our crap anymore, as you know. So here's a link. It's hard to read there, but I'm sure that Gabrielle will share it around. But you click on that. There's lots of information on that Lancet website. There's a range of videos and other material as well, and short pieces. They're not all 50-page academic papers. But this is my final slide. I think following the summer, in my mind, we're seeing the potential for a change in consciousness in Australia about the environment and health and well-being. And I think for us in this room today, our key message is that we need to bring a planetary consciousness to rural and remote health, whether we're researchers, whether we're involved in education and training, or policy or practice. We need to be thinking the big picture at the same time as we're caring for our patients. Thank you very much.
Well, the attrition rate's not bad. We're only losing one per speaker, so that's pretty good. Now I would like to welcome Anna Greta to the stage. Thank you.
Thank you, good morning, and I'll see what I can do about the audience. I just wanted to start by acknowledging Ngunnawal country as well, and I think a theme for today would really be that we have so much to learn from our Indigenous heritage on the tremendous relationship between the land on which we live and our personal health. And so that's a dominant theme when we're thinking about the impacts of climate change. We're going down from the planetary scale that Tony's done such a superb job of giving to us. I'm going to speak broadly about some of the health challenges in the Australian context, and then I think Jenny's going to bring it home to a personal level with the last talk today. But I'm going to speak about the summer we've had, because it's been a lesson, I think, in climate change. So Climate change is, this statement was made by the World Health Organization back in 2015, that climate change is the greatest threat to global health in the 21st century. And it's over the last 5 years or so that has been a rallying call for health organisations, including organisations in Australia like Doctors for the Environment and CAHA and the colleges, as the colleges have become involved in emergency declarations. And now the National Rural Health Alliance joins this call for us all to recognise the tremendous impact that climate change can have on our health. So how does climate change affect our health? Isn't it about energy? It's not. It's also about the way in which we live. So global warming means our average temperatures are slowly rising. But that's not a constant change, and I think everybody living, particularly on the southeast of Australia, understands extreme weather is one of the manifestations that we will see from climate change. So events such as heat waves, floods, fires and storms are all increasing in their frequency and their severity. The health effects of our environment are really interesting, and it's fascinating. The more you look for it, the more you'll find relationships between all elements of our health and temperature variation, water variation, etc. I think we've underestimated it, and particularly when we're thinking about the health of communities. When we're educating young doctors, and I've been a cardiologist for more than a decade, I've been teaching health practitioners and health professionals for a long time, and our focus is often on biology. It's thinking about things on a cellular level. We're looking for the next drug delivery system. We all know, and particularly in a room where we're speaking about rural and regional health, we understand the importance of the social determinants of health in that picture. But the environment, I think, has been missing as the final element that actually it describes the health of our humankind. I have 3 points to pull together to try and summarise that, and I'm woefully ignorant, so I didn't know the Hippocrates quote when I put this together. I think you see climate change and health related to 3 elements. It's in the air that we breathe, it's in the food that we eat, and it's in the water with which we wash our hands. And so if you're thinking, I wonder how climate change and health go together, those 3 elements. Let's think about that. So at a practical level, and that's a view out of Canberra Hospital just around the 30th or so of December, looking out into the smoke, environment and climate affects all elements of the practice of medicine. And again, we're beginning to appreciate this. I think even in a hospital environment, a year ago, doctors were less aware of it than they are today. We know that things like hazardous air pollution and high temperatures affect obstetric outcomes, and particularly we know that there's an increase in premature babies, smaller babies. There's a slight increase in the risk of stillbirth associated with high temperatures, so heat wave events and hazardous air pollution. Male fertility can be affected by heat waves. In paediatrics, anyone in the room with a child who's been through the summer that we've just been through knows that there are going to be developmental effects. It's changed the nature of our childhood, particularly the extreme weather we've experienced in recent time. In emergency, it's the obvious place to see examples of climate change and health because of the extreme weather and the injuries that go with it. And it's not always what you expect. So with the fires in Canberra in 2003, it wasn't fire-related injury. It was injuries from people trying to protect their property, falling off roofs, injured in the garden, trying to make their homes as safe as possible in face of a fire. Obviously, orthopaedics, again, injuries. But climate change has the potential to significantly alter our exercise routines, and I'll comment a little bit on that further. Exercise is key in all elements of our human health. In general medicine, where I spend quite a bit of time, we look after people from a diverse range of backgrounds, and it's often in those environments that we'll be dealing with challenges that are dominant from the social determinants of health. Climate change magnifies that. People who are in rural environments, in regional, remote environments, people where there is socioeconomic disadvantage or social isolation, climate change and extreme weather events are much more likely to manifest themselves in illness and disability and even death in that population. And so in heat waves, for example, people die in their own home because they don't have sufficient insulation. In cardiology, I'm a cardiologist, we know that hazardous air pollution, we know that high temperatures increase the likelihood of heart attack, stroke, arrhythmias. Atrial fibrillation is more common during high levels of air pollution. And so it has an impact on the sort of clinical medicine we do, and again, impacts on our exercise routine. In respiratory medicine, it's obvious, particularly for those, I think it's 15 million, maybe 17 million Australians who've been exposed to the hazardous air pollution of the bushfire smoke this summer. I think the place you see it is actually in geriatrics, and so there are a whole series of points to think about it. But climate change 10 years ago was sold to us as something we should worry about for future generations. This summer shows us it's not a future generation problem, it's now. And so last summer here in Canberra, we had that heatwave event, which started in the middle of January and finished in February. And it was that point of a whole month of really high temperatures where I thought, this is going to radically change the way in which we age. It really impacts on our social dynamics, on our exercise, on our access to the normal elements of life. And so I think you really see it showing, particularly in geriatrics. So people in the room hoping to enjoy a lovely, healthy, long retirement, we should be paying attention to climate change. We really should, okay. Hospital systems, I'm going to just touch on very briefly, and probably that would have been something to talk about, particularly in that room full of people in policy. Hospital systems really need to think about this. A year or so ago, I had an email from a doctor working at Stanhope Hospital in southern Queensland on that New South Wales border. And they said, we don't have a strategy for what happens when the town runs out of water. How do you run a hospital where your town is trucking in water? Can you run and provide services? And so there is such a lot of work to be done at a federal level, at a state level, and at a local level, really working on the resilience of your health system, particularly under extreme weather conditions, including drought. This summer, 2019-20, has been a lesson in climate change and health, hasn't it? So again, in the hospital environment or amongst friends and colleagues, I've been thinking and working in climate change and health for a few years now, and people have looked at me slightly strangely, why are you spending time on this? Now people don't ask questions, they say, how can we help? Because it's become directly relevant to so many of our lives. 3 particular examples: heat, fire and smoke. So I'll touch on these really quickly. I think with heat it's important just to think about the definitions for heat. And so heat is not just about a particular temperature, and we get asked occasionally, so what is the maximum temperature we can survive with? We're still working on that. Can we live in environments where the temperature regularly hits 50 degrees? There's no doubt that has significant detrimental effects on our human health. But heat is about the combination of both humidity and temperature. So low temperatures with high humidities can be just as dangerous as high temperatures with lower humidity. And it's important to take that into consideration. That's the heat stress index, and that's a useful sort of technique for looking at what might be bad for you. Average summer temperature in Australia has risen by 1.66 degrees, and that was to last year, not to this year. This year's been hotter again. And so that's the 20-year rise in average temperatures. And of course, when we talk about average rise in temperatures, that's an increase in extreme weather events. Heat is, of course, the natural disaster in Australia with the highest mortality. And so if we're looking to prevent disease and disability around natural disasters, heat's the bit that needs our attention. The thing that struck me when I'm thinking about heat waves and the heat effects and looking at the research historically is that heat waves have traditionally been discrete. They've been 2 or 3, 4 or 5 days in duration. The heat wave last year here in the eastern part of Australia, in Canberra, and across the eastern seaboard was weeks of duration. And again, we've seen that this summer. It's not been on the front page because of the smoke. It's been on page 4 or 5 of the newspaper. But we've had similar intensity heat waves for longer periods and higher temperatures. So what does heat do to us? Well, it makes us uncomfortable. It's not particularly pleasant being in very high temperatures, particularly for any protracted period. We get irritable. I get irritable. Dehydration is a problem, and we need to work against that. And renal impairment is emerging as an increasingly significant problem. It's a problem particularly in outdoor workers, so our farmers and people working in regional locations who are more likely to spend time in really hot temperatures are more prone to renal impairment. And there are theories that that might explain the high rates of dialysis in parts of our Indigenous populations. Confusion and hospitalisation, particularly in an older population. Heat can cause heart failure, heat causes heat stroke, and people die from heat stroke. Morbidity and mortality rise with the severity of the heat wave. And vulnerable populations. I feel like I said the word vulnerable populations a lot when I was talking about smoke over this summer. Vulnerable populations are at particular risk from heat and from smoke and from all of the manifestations we see of our changing climate, particularly the extremes. I wanted to make a few comments about heat and health, and this is a really helpful chart from Tord Kellstrom, who was here at ANU and now is in New Zealand. But this is explaining the fact that this is not just about our health, but it's also about the way in which our communities work. It's also got productivity impacts. And so there are two ways in which heat can affect you. You can be hot because of the external environment, and you get hotter when you're working hard. It has direct physiological effects on your well-being, so it can affect things like muscles, it can cause renal impairment, it can make you unwell. But the other pathway is about productivity, and so we know that outdoor workers are at significant risk of long-term injury when they're working under higher temperatures. We know that there's a direct relationship between productivity and increased temperatures, as in there's an inverse relationship. We know irritability and violence amongst communities is higher with higher temperatures, and that's particularly when we lose those overnight cooling temperatures. There are economic flow-on effects from an increase in overall temperature, and the health effects are obvious across the community. Quick comment about fire. That's where my family were on New Year's Eve this year. Usually it's a fantastic place to be down on the south coast near Eden. And it was an ominous event for everybody. And I think remembering the stories that are associated with this will be really important as we push this agenda through this year. This summer, our fires were remarkable. We are unprecedented. We had millions of Australians affected either directly by fire or by the hazardous air pollution. I think it's amazing that the numbers are small here. 2,000 structures burnt, 18 million hectares of land, of course. And I don't know if we can quantitate the number of animals that are killed, but I know many of us have reflected on that. I think it's amazing only 33 people died. If you think that the number of people who died in Black Saturday, we've obviously learnt quite a bit about how to reduce mortality associated with fire. But lives have been disrupted, livelihoods are lost, towns are lost, and that's going to have significant flow-on effects, particularly through the mental health and the overall health and well-being of those communities. And we know that from the follow-up studies of events like Black Saturday. Quick comment about smoke. I was working at Canberra Hospital over that end of December, early January period, and I took photos out the window over that first 2 weeks. And went from lightly hazy through to not being able to see the end of the building. And over that period, we were world leaders when it comes to PM 2.5. We've had levels experienced in this city which are really unprecedented and not seen previously. So when we're asked to reflect on what the health impacts of this might be, we have to recognise that there's uncertainty. So bushfire smoke is bad for you. Anyone who, and I would imagine a good proportion of the room will have had some exposure to it, so you know it's an irritant, it makes you cough, it just makes your eyes sore. And there's an acute inflammatory response that comes from the really high levels of bushfire smoke. And so it's a pneumonitis, makes you a bit breathless, makes you cough, makes you feel sick for a day or two, and then it gets better. And in the future, hopefully, we'll know what the long-term effects of that might be. More serious breathing problems were less common, and I think we've been surprised and pleased by the fact that we haven't seen the massive spike in hospitalisations, although there has been an increase. What we did see is that there's been an increase in presentations to general practice with newly diagnosed asthma. PM 2.5 became an obsession of many of us over the summer, and it crosses into, we worry about it because it crosses into the bloodstream. It changes our immune response, it makes vascular events like heart attack and stroke more likely, it's associated, as I said, with arrhythmia, and infections, so things like urinary tract infections, cellulitis, other things you might go to hospital for where you don't make a clear association with the climate around you. In fact, the climate, the air pollution, the temperature has made your hospitalisation more likely. The mental health effects of smoke, again, anyone living with an orange sky for weeks on end understands that this has an effect on our mental health and well-being. And again, it's about our community resilience as to how well we'll recover. These were unprecedented events of uncertain long-term significance, and we need to learn more about that. And of course, the federal government donated or has put forward $5 million for research into bushfire smoke. I'm a cardiologist, it's impossible not to talk about exercise. The exercise in our changing climate, I think, does warrant some thought. Exercise generally is really good for you. Heat, smoke, fire, drought, the changed environment. And I grew up on a farm on the outskirts of Melbourne. My grandfather was a sheep farmer. I lived in Wagga for 5 years. I know what it's like to live in a rural environment, and I know how the aesthetics of that place can be remarkable. It can be amazing to go for a walk in the morning and see the sunrise or see the sunset at the end of the day and be really pleased to be in that place. Solastalgia describes that emotional response that you have when that landscape's changed. And so walking outside, and these are some of the hills around Canberra that are devastated by drought, and it really changes your enthusiasm for getting out there. The health consequences of this may be of increasing significance, and I suspect we'll begin to see a lot of this reflected in both morbidity and mortality across Australia in the next few years. So just finally, a few take-homes from the Black Summer, and I don't know what the right terminology was, we're all still working on it. It was unprecedented, it was extraordinary. We're seeing a rapidly changing climate, and many of us are quite uncomfortable with this idea of the new normal. We need to be prepared for things to get worse. It's a rapidity of change, things are escalating, we're not seeing things stabilise from a climatic perspective. Extreme events that previously lasted for days are now lasting for weeks, and we see that in our heat events, we see that in our bushfire events. We know I lived through Black Saturday, and I was in Melbourne on a farm in Ash Wednesday in the 1980s. Those events were short and discreet. They were awful, but they lasted for a few days and they resolved with rain. This year was different, wasn't it? The additive risk of heat and smoke and fire is significant, and again we tend to pull things apart to look at one particular element, but the additive risk of the three things together on a vulnerable population has significant health effects. The health impacts of climate change are broad and affect a large proportion of the Australian population. Predicting and preparing events would be good for us, it strikes me that I personally failed to prepare for smoke, and I feel bad about that. I've been thinking about heat for years, I've been worrying about heat, I've been talking to people about getting better preparation for heat waves, and we knew there was fire coming, and yet we weren't ready for a major problem with air pollution. And so how could we have done that better? I think if we'd met up last year sometime, maybe the middle of the year when we were all beginning to worry about the summer ahead, and we'd had environmental scientists, doctors, government maybe in the same room together, we would have predicted that smoke could be an issue. And so we should think about that for the future. Health is, of course, a key argument in the politics of good climate change policy, and again I take that forward into the debate at the moment. The final slide, to finish on a positive note, is that climate change is also the single greatest global health advantage or opportunity for the 21st century. And when we're looking for reasons to act on climate change, human health should be at the centre. The synergies of action in terms of active transport, walking a bit more, using our vehicles a little bit less, and trying to eat as well as possible, they're beneficial for us individually as well as for a community.
Thank you. Thank you, Anna Greta. And it looks like we're going to lose a Warren.
I'm sorry, but
You know.
I've got to chair a committee in about 7 minutes. He's also on it, but I'm going to make an excuse for him.
All right, sounds fair. We all agree, sounds fair. As I said, my name is Jenny May, and I'm going to give you a bit more of a personal reflection, and I'm going to probably go off-piste slightly to my topic, which is mental health, which is that I'm thinking about rural communities and their responses and seeing climate change really as an additive risk on an already fragile system. And it is a personal reflection. So last Thursday in my general practice, I spoke to patients about their health, as I would, and one particular patient stuck out. So after 3 crop failures and an impossible overdraft, they'd made the decision to sell. And it was an appropriate decision that they would sell when the rain came. So they've just commenced that process, and they'll walk away with little in the way of capital, but they'll have enormous relief because obviously they don't have to watch their animals getting thinner, and they don't have to watch the land that they farmed for the last 3 generations get hotter and hotter and drier. And that is the reality that I'm living with as a general practitioner and as a resident of a rural community. And they will go to a place, probably urban, where they will have less threats on that regard, but they'll lose the considerable community and social connection that they had in the community in which they live. Another patient who told me that he dropped his private health insurance, which was a little bit of a disaster because he desperately needs a knee replacement. He's now going to be on a waiting list of 1 to 2 years, and on that waiting list, my bet is that he will gain weight and he'll probably drink a little bit too much, and his condition, his overall condition and his capacity to enjoy his latter years will be severely impacted. The third patient shared the really sad news that their grandchild with leukaemia had just relapsed and been airlifted to Sydney. And she said to me, "That's not a rural problem, that's an everybody problem." But I recognised that she was doing that on top of considerable job insecurity. So her job at one of our local retailers has cut from 36 hours a week to 32 hours a week to 26 hours a week, now to 20 hours a week, now to, I'm not sure whether we'll be open in a month's time. And on top of that, she was living with a husband who has severe depression. And she was living with the uncertainty of his mental state and what he might do. And one of the reasons for the consultation was to work out how we might be able to safety net him if she was going to leave town. Now, I don't need to tell you about the impact of suicide. We've all been there and we all know the horrendous impact of suicide. But I can tell you anecdotally that there appears to be an increasing rate of suicide in some of our rural communities, and certainly it is a lived experience for me. So I'd say rural Australia is really feeling the heat. And for many of us, the problem is repeated trauma, and this issue about climate change and repeated trauma, and the additive effects of distance and access. Now, we know that good mental health is associated with secure housing, with income, with employment, but also with connection and autonomy. And as we know, much has been made of the capacity to build resilience in the face of difficult times. And many of us learn new skills and mentally adaptive ways of thinking and doing and emerge stronger. This, however, is not a universal experience. And there's also a realisation that repeated trauma and insult to people's equilibrium and their security can lead to poorer health and other consequences. So my question was, how do I approach the health and well-being of rural communities in a way that ensures their sustainability after the drought is broken? So I haven't got numbers or PowerPoint, but what I'm going to talk to you about is 3 issues. Some of the economic realities of living and working in rural communities, some of those impacts, and hopefully some of the ways in which we can help communities and think about policy, long-term policy, to help them survive and thrive. So obviously there's been a theme in those patients who had, significant mental health issues around finances, and they relate to negative equity. Many of the people that I see are living on overdrafts. Many of our industries have hugely long lead times and therefore huge levels of long-term debt. We've got downstream service industries, which I described, which will hurt while ever there's no money in our communities. We've got climate insecurity, which is really challenging the confidence that people have to stay in place in their communities. And we've got a disconnection, which we haven't really mentioned today, between land and water rights, which is certainly making communities very insecure in the long run. And as Warren Ench mentioned, the issues around insecure insurance and increasing fixed costs. So these are all downstream implications of the funding and the economic base changing in our rural communities. And they're things that I think we need to think about very proactively. I like to think that we celebrate the multiplier effect when we bring a new industry or service into an area. Are we actually considering the multiplier effect as climate change and structural adjustment and economic issues impact these communities? There's the other demographic change that we don't talk about, and I'm going to, and that is that there's this structural change occurring in some of our smaller communities. And that's based on a move away from generalist service delivery. So if we think about being a lawyer, are there lawyers in our towns of 6,000? Increasingly, there's the family law expert, and there's the family tax lawyer, or there's this person or that person, and we're seeking those people out of town. So that generalist role for the general lawyer or the general accountant in a town in our area like Narrabri or Moree is really quite challenged. Now, obviously in medicine, it's very similar. So we're moving from this generalist model with a wide scope of practice to an intention to look for specialist service models. And very much because of the capacity and size of our rural communities, they are often specialist services that are fly in, fly out. Now, are there alternatives? Well, I think there are. The impacts of these changes are more than that with the people that are in the towns, but they're also impacting on critical mass for things like health and education and that quality we're looking for, social cohesion. So in health, we see these economic impacts with unviable health practices and the difficulty attracting health professionals, because I've described to you a litany of hollowing out of some of our rural communities, hardly attractive for some of our younger professionals. So what we're seeing is that market-driven model of allied health, general practice and dental delivery really struggling. And I think the comment about AMSs and looking at the strengths and weaknesses of the AMS model, it very much should map into informing what models work well in our smaller communities. I believe that a generalist, locally based team remains the gold standard for delivering cost-effective long-term health outcomes, but I don't see a willingness to invest. So I'm going to talk about a rural community as my patient. I'd think about them as having a chronic disease rather than an acute illness or an acute insult. I think we've really got to align our resources and assistance in a measured way to think about a long-term outcome. How do we do that? Well, in health, we look for good self-management. So that says to me we're looking for autonomy. So we often say that one local community is one local community and you can't generalise. But often people in these towns know where the opportunities are and where the security needs to lie. And certainly in our town and the way we've managed continuing drought, very cost-effective investments locally, helping people in a sustainable long-term way. Without identifying anybody, things like providing money at the local co-op so that the co-op can make the decision about throwing an extra bag of dog food on the appropriate farm truck that will enable people to have the dignity and respect to be able to feed their dogs and continue to prioritise their own health and their own spending. Those sorts of things. So what are we doing, or what could we do to invest in long-term secure funding? Well, I think we need to move and think about security as a real issue. So my contract, I'm very fortunate to have a contract with the RHMT program to run a gain, train, retain program involving incentivising and supporting rural students, providing training and hopefully working on the retention end. But my contract ends at the end of the year. So there's 60 people across northwestern New South Wales who have no security of employment beyond the end of the year. Now, if they lived in a metro area, that's fine. They can go and find another job. But if you're going to expect people to move to town, how can you do it on a 12-month contract? And if we're thinking about mental health, how can I expect a psychologist to come to town on a 12-month insecure project? That's not good self-management. That's not good for them. And it's certainly not good for us. So I think we've got to develop enviable infrastructure and models of primary care. Now, NRHA talks about place-based and wellbeing networks that are locally based and involve that longer and wider and if you like, structural generalism. And certainly we've got to get better at promoting and translating technology and AI and recognising some of those structural changes and embracing them and working out how they work for us. That probably means investing in rural communities and rural research, and investing in rural research in rural communities for me is a big one. I think we've also, if we're thinking about chronic disease, got to think about promoting reality and being proactive. So proactively, I'm really excited that there is a rural generalist medicine program that's gaining legs, and it will certainly need to happen in nursing and allied health. We've got some disablers locally, and some of you may not be aware that the Department of Health has now identified that you can't claim a mental health item for in general practice at the same time as another item, that they've got to be separate. So I say to you, if someone's driven 60 k's to come and tell me about their sore knee, but I actually know that their main problem is the depression and anxiety that's running with their overdraft, that I can't bill those two item numbers together. So I've got to be proactive, and we've got to be proactive in this room and work with those disablers and get them straightened out. And let's look at our advantages. We do have, in many communities, high levels of social cohesion, and that is very attractive. And one of my jobs is to sell that and to showcase that to the new generation, because it is very attractive. I think we've got to work at place-based training because I think we can do that well. And I'd love to see mental health nurse training, for instance, done solely in rural communities. And I can see little reason why it shouldn't. So as I finished at the general practice last week and looked at the sadness and burden of grief, which I did feel very personally, I thought, is there loss? Yes, there is. But is there hope? Yes, there is. There's both hope acutely to reduce the disablers and to harness the goodwill we've seen to build that very short-term response, but there must be hope to look at a sustainable, non-market driven support for these rural communities. And I believe health and education are the absolute places to start because they make rural communities attractive. Building community resilience is a long-term concept, I thought, not an appeal slogan. And as Gordon Gregory said in his recent Croaky article, resilience is not a reason to let governments off the hook as service providers whose challenge is providing equivalent access to such things as health, education and broadband. So let's recast some of the climate challenges that we've heard about today and use them as an opportunity to recognise long-term, locally driven solutions and know that if we do that, that we will provide real hope for better mental and physical health for all rural Australians.
Well, what a fantastic lineup of speakers this morning. So can I ask you all to put your hands together for a range of fabulous talks. It's interesting that many of the people that spoke here this morning were from a country rural background themselves. I can't claim that. I was a girl who grew up in Sydney, but I ended up being one of those health professionals that left Sydney and went out to Dubbo to be the sole dietitian for the Arana and Far West in New South Wales that covered a quarter of the state. My sort of relationship, I suppose, with farming areas was that my mother used to take us in caravan trips around New South Wales. And when I was about 14, I remember saying to my mother, when I grow up, I'm going to marry a poor farmer. And she said to me, like, why the poor farmer bit? I said, I like the idea of a struggle. I didn't realise how much of a struggle that was going to be because we ended up on farms but did have to leave farms for these very reasons about remaining viable. Look, our main reason for meeting here today was to engage with our parliamentary friends that are so ably led by Warren Snowden and Warren Ench. It's a shame that Warren the younger, had to leave a little early. I knew when I sat opposite Warren Ench at the annual dinner last year at the Arboretum, I knew that whatever he was going to have to say wasn't going to be dull. He was a little more tame, actually, this morning than he was at the annual dinner. But he did have some really interesting things to say because he was talking about this morning about insurance and the cost of insurance. And interestingly, friends of ours, because we lived at Adelong near Tumut for 8 years back in the 90s, and our friends from Batlow who have an orchard up there, they lost quite a number of their trees in this last bushfire season. And Scott Morrison actually went and saw the cattles and he asked him, do you insure your trees? And he said, oh no, we don't insure our trees because it costs us about $1 million to do that, were we to do that. So things like insurance is a huge issue for people on farms. They actually had to destroy, they had about 1,000 head of cattle as well that they had to destroy. So it is, really, the impact is just incredible. Warren Snowden, you mentioned as well the Bruce Pascoe book, and I have read that as well. And apart from that whole connection to country, the thing towards the end of the book that really struck me was actually about the way in which relationships and how Aboriginal people, there was no dominant nation that tried to overtake another. And I think there's so much that we have to learn about that as well as about country as well. And I was, having never gone to the Northern Territory until a few years ago, I was fascinated with all what they call the cool burning. And we kept observing this when we're going out to Kakadu, and it was completely new to me, and it just, you do realise just how little we learn and how much we have to learn. But we very much appreciate the combined support that you show to the rural health to the Alliance as well. Today we also had Tanya Lehman, the chair of the Alliance, and she outlined our position statement on climate change and rural health, which calls for a national commitment to the climate and health policy agenda to ensure that our rural, regional and remote communities can actually thrive in safe, healthy and sustainable environments. Tony Capon, he's spoken about, and he is actually going to be one of our keynote speakers for our 7th scientific symposium to be held in Alice Springs. That's a little plug. He's spoken so eloquently about the ways in which rural people are impacted much more directly with climate change than our metropolitan counterparts. And he's spoken as well about this planetary consciousness that we must have. So that's something that I'll be taking away today. Having said that, here in Canberra, as Anna Greta has spoken about, we were actually very much affected by the bushfire season, and the poor air quality got international attention. I've got some former pen friends in places like Norway who kept emailing me and sending messages to me to ask how we're going in that sort of in the bushfires and also the whole issue around air quality. And so Anna Greta has very passionately and also very eloquently spoken about the smoke and heat stress that are a product of our warming climate, and that's having such a negative effect on our health and well-being as well as our productivity. I also know that you spoke quite a lot, Anna Greta, about exercise, and I'm a rower, but I'd say that over this past summer I probably only got on the water probably 4 or 5 times, so it certainly had an impact on the way my usual exercise habits. The issues of drought, bushfires, floods and other severe weather events are having a direct impact on rural health and well-being. It's affecting their livelihood, as others have pointed out, their mental health, their community social capital and the sustainability of smaller towns that rely so heavily on agriculture and tourism, particularly down our south coast. Jenny May has revealed through stories of lived experience that climate change is having adverse effects on communities in ways that move far broader than just policy implications go beyond health. At the Alliance, we are supportive of short, medium and long-term responses to the bushfires for rural communities from a health perspective. Now the response must be to deal with the immediate impact of bushfires on individuals and communities, including the physical and mental health impacts, but also on those underlying stresses that Anna Greta has spoken about, but also Jenny spoke about. Assistance on matters to do with climate, to insurance claims, emergency financial assistance, and rebuilding paddock fences are the things that are needed now. It's the next phase will be about ensuring that there's sufficient access to high quality psychological and counselling services for those who don't recover from the trauma of these bushfires. It'll be important for the health professionals that are already living and working in those communities that are affected by bushfires to be able to provide that additional support that their communities need, avoiding where possible the drive-in, drive-out services. We're heartened to know that $2.7 million of the money that the Australian government has put forward in response to the bushfires will be directed towards community-led activities, because this is where people will be making social connections, using their imagination and creativity to find solutions for the recovery of rural communities in the short, medium and long term. But ultimately now is the time to address climate change at all levels of government, in organisations and in communities. Mitigation and adaptation efforts that safeguard local economies and social capital, address extreme weather events, water scarcity, water quality and promote positive health and well-being are urgently needed. Following on from our position statement, our policy team will continue to build a suite of policies that address the different components of that position statement, commencing with the impact of water scarcity, water quality and food security for individuals, health services and communities. The Alliance is already trying to take a lead in very small ways to reduce our carbon footprint. We only have 2 face-to-face meetings of the board annually, and the rest of the time we connect by digital technology. We attempt where possible to conduct sustainable events by reducing plastics and composting food waste. At the Secretariat, we are an accredited recycler, contributing to worm farms in Canberra and recycling paper plastics, including our soft plastics. When travelling to Sydney or Melbourne for meetings, I use public transport and active transport wherever possible, saving money at the same time. But there's still more to do. The Alliance, I think, is well placed to be the conduit for exchanging ideas on how the health sector can contribute more meaningfully to reducing our carbon footprint at the individual community and population level. There is much to learn from our Indigenous member organisations about taking care of country and the importance of a broader understanding of health and wellbeing that includes connection to country. I was recently reading a paper by Blaschke and colleagues about the role that general practitioners can play in responding to climate change. Their skills and experience in general practice, which are considered complex adaptive systems, could be applied to finding solutions to the dilemmas of climate change. In my own profession of nutrition and dietetics, the Food and Environment Special Interest Group has conducted continuing professional development programs over the last 10 years to educate health professionals about the need to improve food system sustainability. That same special interest group has developed a number of resources to help people to reduce their food waste. Last year I was involved in a small project with the Fisheries Research Development Corporation to develop resources to assist clinicians and the general public to select seafood species that are both high in omega-3 fatty acids but come from sustainable fish stocks. No doubt there are others in our membership who are and can play a key role in bringing together community-wide transformations that will effectively address climate change. Before I finish, I wanted to thank the team at the Secretariat, particularly Leanne, for her absolute precision in organising events, and to Jo Walker for her role in writing our position statement, and to Tim Hurd, our communications manager. But everyone on the team has put in a huge effort for today. I want to thank you all for coming as well, and I do hope you have plenty of opportunity to reconnect with people you know and make connections to those you perhaps haven't met before. When Leanne was actually coming to me and organising this event, and she wanted to discuss the breakfast options for today, and she said to me, "Look, I think people just come for the speeches. They're not really interested that much in the food. So I think we can just do a stand-up breakfast." I said, absolutely no way. I said, I'm not going to have some miserable bit of honeydew melon or a sweet Danish pastry. We're going to have a proper breakfast. So I do hope that you have enjoyed the proper breakfast today, because once a dietitian, always a dietitian. Thank you.